Setting up users' preferences. In the configuration area, you can make changes to your personal preferences and to organizational settings when you have administrator permissions. On the User Organization tab, the top table records information related to you for the TherapyCharts team to contact you regarding your account, as well as personalized information like your NPI and EIN numbers. If your organization allows individual billing preferences, you can choose to create invoices when the progress note is created or when it's signed. Additionally, you must specify what NPI and EIN should be used with claims. The continuity of records box is particularly important for clinicians in private practice. This field provides instructions to our team regarding who we should provide access to your clinical records once they provide proof that you are incapacitated. Organization information is used for all headers on printed forms and is the information regarding your practice that you want patients to see. This also includes an NPI or EIN if they are different for your PLLC than for you personally. The last table on this form is the Change Password field. While you can change your password, we strongly encourage that you maintain the random password generated by the system. If you must change your password, make sure it has sufficient strength and is not a password you use for any other site. The General tab controls all of the settings for automated behavior throughout the site. You can select an international standard or USA standard for date and time, which will be reflected in all of the date fields throughout the site. The timestamps are all presented in International Standard UTC and cannot be modified. There are 3 color themes to support the 508 accessibility standards. In order to assist clinicians prevent multiple patient charts for one person, by default, the system will not allow you to create a patient with the same first and last name and date of birth. If you wish to turn this restriction off, you can check the box to allow duplications. To help save time, some clinics will automatically activate and deactivate patients when intakes and discharges are signed. Deactivating patients may be particularly important if you are on a plan that restricts the number of active patients within your account. The progress note preferences allow clinicians to set what the behavior of the form should be when the new button is pressed. You can either select to clone or not the narrative field. You can also set how the form generates the service date and time, either from real-time data or your appointment calendar. You can set the time between reminders to complete reviews. When you submit feedback, our staff will respond via an internal message. Some users find it helpful to set up their accounts to open to the Message tab when there are new messages. Others prefer just a boasted prompt. All of the icons that change color as a documentation prompt on the patients list have their date spans set here. You can select the time frames that make sense for your organization based on policies and procedures in your office. For clinics that need to collect customized data, it may be beneficial to set up custom fields to appear on the various forms. You can either have them added when the patient is created, such that they may be removed from the form at the clinician's discretion, or when each new form is created, such that they always appear for clinicians to complete. The last option on this tab is the printing preferences. You can either have files downloaded to your system as docked, ODT, or PDF based on your operating system. Some larger clinics like their clinicians to set open times for either all scheduling or specific types of scheduling, like intakes on the Calendar tab. Here, the time slots will show for support staff as available for patient encounters. Billing configuration includes the diagnosis preferences that your organization uses. Most clinics choose a standard reporting option, whether ICD-9, ICD-10, or DSM-5. Some clinics need the table to show all of the options, as different insurance providers may require different diagnostic codes. The service and billing location allows users to add where they provide service or, alternatively, the billing location that should be associated with claims. The system will allow administrators to automate the creation of invoices to clinical documentation. These invoices can be set to create on an organization level when notes are created or when notes are signed. Some clinics allow each clinician to set this preference in their own account. Invoices may be connected individually to each note or batched by a set time frame to record all services provided for a patient in a day, week, or month depending on how the clinic processes patient payments. This is also the area that includes the service code tables for the standard price of service codes within the organization. The Documents tab allows you to set the size of files allowed to be uploaded to the system. It will also show you the space used across the organization and by each user. You can buy more space if necessary by clicking Buy More Space, which will increase your monthly price $1 per gigabyte. If you had previously used TherapyCharts, you can upload your patient files through the Import tool. If you're leaving our system or need to generate a backup, you can export your database through the Data Liberation tool. Delegation is an option that allows clinicians to give access to their accounts should they need to, like when they are on vacation, so that other providers may document any patient contacts or access records in the case of an emergency. To give delegation, you would simply click the Add Delegation button, enter your login password, enter the username of the clinician you are granting access to, and enter a mutually agreed upon secure password for the therapist to use to access your records. The delegation will show in their account on the Delegation tab under Received Delegations. Clinicians can delete these delegations when they are no longer necessary. Sometimes our tech team may request delegation to your account. It will always be to TC Tech 911. The Payment Method tab allows the account holder to enter, update, and delete credit card information that automatic payments are billed to by TherapyCharts. To add a new card, click Add Card and complete the form. To delete a card, highlight the row and click Delete Card. Most users only need to update expiration dates. To do this, highlight the row and click Edit. Once you have updated the dates, click Save. We strongly recommend that clinicians keep only one billing card on file. Administrators can use user management to add users and, in emergent situations, remove access to accounts to their staff. All cancellations must be done through a feedback message to our team. This page also allows staff roles to be created and permission sets to be assigned. Support staff are free on the system as long as their permission sets do not grant them access to create clinical documentation.